So this is the largest prospective observational cohort of polycythemia vera patients. Not all patients were enrolled at diagnosis. Patients could be enrolled at any point during their disease courses. There were a total of 2,510 patients observed on this study, and 2023 had a confirmed diagnosis of PV, where we were pretty certain that these patients actually had PV. The balance of patients may or may not have ultimately had PV. So we examined that subset of 2023 patients where we were confident that they had PV and looked to see which patients had signs of progression to myelofibrosis and which patients didn't. And looking at the characteristics of those two groups, the transformed and the non-transformed group, we noticed that the group that had transformed had a longer duration between diagnosis and enrollment on the study. The MOST study is limited by its being an observational prospective trial, which is great to generate hypotheses and learn more about disease processes, but it doesn't really tell us how to intervene. We can look at real-world data and try to see how low-risk patients did with various therapies, but I think that the real proof that a therapy can make a difference for low-risk disease is in clinical trials. And what I'd like to see in the future and be a part of are trials that intervene early in lower risk patients who might actually not really be lower risk. They might be lower risk by our standard scoring systems, but they might have some features that would lead us to think that they'd be at high risk for progression. And if we could intervene early, we might be able to make a difference in those patients' lives. Of course, there's a balance because we don't want to introduce toxicity early, and there's always the consideration of going through therapies too fast. Maybe if we offer a patient a therapy too early in his or her disease course, we don't have that option available later when the disease progresses. The good thing right now in the MPNs is there is a wealth of drug development. There are a lot more approved drugs now than there were 5 or 10 years ago, and there are so many drugs, there's so much interest in drug development right now that I have great optimism for progress. And I think this consideration of going through therapies too fast will go away once we have a lot more options for patients.